Well, wow. I mean, great turnout. I appreciate you guys all being here. Thankful for the weather. I was teasing Haley earlier. I said you did a great job coordinating this, including the weather. You just did a phenomenal job. You know, standing here with you guys today, I honestly am feeling a little bit overwhelmed. It's been a hectic couple weeks, but really I feel overwhelmed because there's a tremendous sense of pride that I have, excitement for what this hospital means to this community, and what the beautiful facility is going to mean to Fayette County residents for years to come. Obviously, we've been working on this for a very long time, and we've been talking about it for a few years now, but at the end of the day, I think being here with you all and sharing in this excitement with you guys is truly something special. This new hospital represents, in a sense, a fulfilled promise. That promise was made back in 2021 when Fayette County Memorial decided to join the Adena family. Larger than that, though, I think this promise is a promise to this community. It's a promise to the patients and families that we get the privilege of caring for every day. Just as important, it's a promise to the fantastic team that we have at Adena Fayette Medical Center. We are here today to break ground on a state-of-the-art 65,000 square foot facility, center of care, if you will. With this facility, we will have obviously 24/7 emergency services in private treatment rooms. We will have enhanced diagnostic imaging capabilities such as MRI, cardiac CT, nuclear medicine, just to name a few. Whether you are arriving to the new facility at 2 a.m. with chest pains, or perhaps you got a sick kiddo at home that's experiencing a high fever, you can rest assured that when you show up to this new facility, you will be receiving timely, high-quality care with some of the most advanced tools that are available in the healthcare industry today. This new hospital will also include expanded specialty services such as orthopedics, oncology, pulmonology, non-delivery OBGYN, several others. This is something that we take a tremendous amount of pride in currently. We offer so many subspecialties on this campus that not a whole lot of rural environments get the opportunity to have. And so there's no doubt in my mind that this new facility will only equip us to be able to provide even more capacity in those settings, but also explore other specialties down the road. The upgraded surgical suites is something that we're extremely excited about. The upgraded surgical suites will not only allow us to double our capacity in terms of the number of cases that we're able to do, but it will also allow us to explore things such as the robotic strategy that we have and we're currently in pursuit of. The on-site pharmacy that comes with this new facility will include a retail option. The retail option is important to the community because we can then fulfill the prescriptions that are needed before the patients are discharged for the day. Today, they got to carry an extra step of care and go down the street to fill those medications. Our progressive care inpatient unit is something we're also extremely excited about. It'll have 25 private rooms. It'll allow us to continue to care for the same critically ill patients that we care for today. But more importantly, it'll help us expand the scope of services that we offer in that setting so that we're equipped to take care of even more patients in the future. Lastly, the improved parking and just the overall facility layout itself was designed with one goal in mind, and that was to make care easier and more comfortable for the patients and families that seek us out in that time of need in the future. Make no mistake about it, this hospital is for this community. It's for the parents of the sick kid that I mentioned earlier. It is for our seniors that are perhaps managing a chronic condition and can't afford to leave the community for their care. just as important to me is for the amazing caregivers and providers so that they have a facility that they're proud to work in. I do want to take a minute to recognize all of the amazing providers and caregivers that we have with us currently, and those that preceded us and paved the pathway for us to all be here today, celebrating this monumental occasion together. It's the dedication, the passion, the conviction that they show each and every day to our patients. You guys are the reason why we're here. You guys are the ones that have made this possible, and I thank you deeply for that. You know, care feels different when it comes from someone that knows your name. This hospital is bigger than us just building walls. This is really about us strengthening the bond with this community. And so we talk all the time about family, friends, and neighbors, taking care of family, friends, and neighbors, right, Deb? Yep. That's what we do, and you have my word that that thought process and approach will carry over into the new facility when we open the doors in 2027. We obviously appreciate all the individuals that had a hand and worked so hard to ensure that we have great care in this community today, but well into the future as well. I want to especially thank my leadership team and my entire medical staff that just do phenomenal things for our patients behind these closed doors every day. I also want to recognize Robin Haddon, who's recently joined the Adena team. She has joined us so that she can help head up the philanthropic efforts here in Fayette County moving forward. I think it's important for us all, I should say, to recognize that this hospital is deeply rooted in community support. It was the kindness and generosity of the community some 75 years ago that made healthcare possible in Washington Courthouse those several decades ago. And although Adena is committed to the $70 million investment to make this new hospital a reality, it is the continued support of community members such as yourself that's going to help us advance the care and, quite frankly, maximize this facility's potential for decades to come. Finally, our team has just worked tirelessly behind the scenes to make your patient experience better, more convenient, more connected. I want to thank you all for trusting us. I want to thank you guys for standing with us, but more importantly, I want to thank you guys for helping us make this vision a reality. So to learn a little bit more about what this hospital means to the community, I want to hand it off to Brian Reed. He's the Adena Fayette Medical Center Board Chair.
Thank you, Josh. The work you and your team have done is very much appreciated. Hello, everyone. Hospitals are one of the cornerstones of any community, not just a place of healing. They're symbols of strength, stability, and an investment in the future. This is truly an historic day. For more than 70 years, this hospital has stood as a pillar of care in the community in all of Fayette County. As we look to the future, it was important to us to see the new hospital and honor that legacy. Not just through advanced care, but through thoughtful design elements that reflect our rich roots and the values that define this community. The architects worked a lot to thoughtfully weave in elements that reflect Fayette County's farming heritage, its deep ties to Washington Courthouse, and the enduring commitment to those who serve this hospital. The combined use of glass, stone, brick, and composite panels on the hospital's exterior mirrors the patchwork of surrounding farmland, and the building's angled shape draws inspiration from the sight lines of the roads that lead into the heart of the downtown. These details create a space that feels deeply connected to the people and the community that it serves. From an economic standpoint, the new Adena Fayette Medical Center will have a profound impact. It will bring job opportunities. It will attract new talent and serve as the foundation for growth across the county. More importantly, it will provide peace of mind, like Josh was saying, to the community, knowing that the care we need is right here, close to home. It makes a real difference for families, businesses, and the health of our entire region. Today's groundbreaking isn't just the start of a construction project. It's the continuation of a legacy. It's a statement that Fayette County is growing and our people deserve world-class care. I'd like to invite Dr. Emily Johnson up to share her personal experiences on how this will impact our level of care. Dr. Johnson is the Chief of Staff of the medical group, and most importantly, she's my PA.
Thank you so much. So it truly is a privilege to be here today representing our Adena Medical Group and the medical staff of Fayette County. When I first came to the hospital and interviewed more than 15 years ago, I have to confess I drove right by the building. This unassuming hospital, though, I found during this time here is just an exceptional place of care. The high quality care that our physicians, our advanced practice providers, our nurses, and our caregivers give each day is second to none. And it's always been a point of pride that I've had in being able to say that I still practice clinically in Fayette County and will continue to do so moving forward. But I can tell you as the Chief Medical Officer of our Adena Medical Group that so many of our surgical and medical specialists are eager and excited about this day as well. They're asking for updates on where we are with the groundbreaking because they want to be a part of this. They want to be a part of the excitement. So this has become an opportunity for us to recruit additional talent to join our team. We're looking forward to the experience our patients will have in an environment that reflects that high quality of care that we give each day. So it's just an exciting time for me to be able to reflect on that and hopeful for the future that as patients enter, that they're going to experience care that's going to promote healing, that as our caregivers work each day, that this is a commitment to the ongoing work that they're doing each day and the devotion that they have to our patients. So thank you so much for being a part of it. So many of you have been part of this dream and vision, so it's exciting for you as well. I'd like to invite up our representative, Bob Peterson, to speak a little bit from our community perspective. Thank you so much.
Thank you very much. On behalf of the community and maybe also my colleague, Senator Shane Wilkin, who's unable to be here, he's working for you in the State House. But on behalf of the community, this is awesome. How incredible is this? Truly a blessing. You know, Fayette County is a special place, but we're not a very big place. And I don't know of any other county in the state of Ohio or really across the Midwest, population of 28,000 people, that's going to have a world-class hospital sitting in the middle. We are special, and this is awesome. Thank you to Adena for making this dream possible. I'm also greatly appreciative of everybody who in the past helped us get to this point. You know, I think about my time as a county commissioner years ago. We worked real hard, frankly, just to save the hospital, just to keep it here, keep it in place. With apologies, we may have flirted with other hospital systems. But we were just dating. But we found the right partner. The commissioners found the right partner. And I'm, on behalf of, Delbert Haynes, Tony Anderson, Jack DeWeese, John Schleich, to the people I served with, that tried to keep this place here and viable for the community and also for this future that we're going to experience in the next few years. We truly are, as a community, are very, very appreciative. I'm also appreciative of the great leadership we have. Brian, you may have missed a couple pieces of history when you talk about this hospital. You see, I was born here. And that shouldn't be in the history books. But as my parents told me, every nurse and doctor in the hospital came to see me when I was born. And not that I was the prettiest baby or even the ugliest baby, but my mother worked here. My mother was an RN, worked in the hospital for over 30 years, retired from this place. And as has been mentioned earlier, our children were born here. All my siblings were born here. I've had stitches here. I've had x-rays here. All the things that are our community. And one thing that is profound, that I profoundly remember that happened 20-some years ago, is our beautiful little 2-year-old Hannah came here for a little minor surgery. Not a big deal, unless you're the parent holding this child that you love. And everything's going to be fine, and you know it is. But it's real comforting when you hand it to Pam, a friend you've known for 20-some years. And that's the value of a community hospital, and that's the thing that Adena brings. in Chillicothe, and now here. And we as a community are extremely grateful and thankful, and we look forward to celebrating grand opening, because the only thing better than groundbreakings is grand openings. God bless you.
Really do appreciate y'all coming out today. Of course, with this weather, where would you rather be? As one of 3 commissioners, Donnie Fleek, I know you guys are here, Jim Garland. Hold your hands up, wave, or go sit in your car. I'm not sure which you got. But I appreciate them being here. It's a great working team. As you have clearly stated here, you need that working team to be able to get jobs accomplished. And I cannot be here without noticing the current board members, Brian, but the previous board members that struggled with the heating, the cooling, the windows that needed upgraded, the generator that's still here since I was born here in '53. I'm not supposed to say the year, am I? But, you know, the community coming, my kids, their kids, some of your kids, some of their kids, you know, will have a world-class facility within 10 miles. I don't think you can get much further than 10 miles and still be in a county. So you've got great opportunities here. We're going to bring in some excellent folks. Jeff, I can't not say thank you. We had some interesting conversations over the years, not just about this, but the hospital, the boards have been extremely supportive, and the folks of Fayette County. We get a little nervous sometimes, a little distracted sometimes, but when we think about what it is we want to get done, when we can focus, we'll get there. So thank you all for being here. Thank you, Adena Healthcare, and the Board of Finance at Adena that helps get this put together. So thank you all.
Thank you, Tony. Also here with us today, my name is Jeff Graham. I'm the CEO of Adena Health, and I'm really excited about today. As people have mentioned the weather, I'm really excited about the weather because the odds the way this spring has went so far, we could be in a monsoon right now or a hurricane with the winds that we've had. But it's really exciting to be here. I also want to take this time to recognize other representatives, not only from the state, but also from our federal government and Congress and Senate that are here. Representing Congressman Taylor is Kelly Foss. Kelly is here. Thank you, Kelly. Also, our Fayette County Commissioners, also Steve Lee from Senator Marino's office. I don't know where Steve is at, back here. Thank you, sir, for being here. And then also the mayor here in Washington Courthouse, Joseph Denon. Let's give him a round of applause for all the support that they give us. So as usual, I always ask the team in communications to write me some talking points. And like usual, I get caught up in the moment here. And I go, I don't want to talk about that. I want to talk about something else. Let the helicopter fly. So as I reflect over the journey up to this point, Tony's comments, a lot of well-thought conversations on how do we get from where we were to where we are today. And I think back to those conversations that I had with Mike Diener, who was the CEO here at that time, and talking to him about what our mission is and what Fayette's mission is and what we could do together as an organization. And I think about the board discussions that we had about the decisions they had to make on who their partner would be that would keep their mission alive here today. And there were so many things that could have happened. And as I said to someone earlier, there's so many reasons and why we might not be standing here today. But because of the leadership, both of the board and Fayette Hospital back then, the leadership at Adena and our board and their support, looking at our mission and our vision of keeping rural health care close to home where people don't have to travel for care. But not only that, being able to bring the state-of-the-art care to the communities that we serve. And today is another example in stepping forward with fulfilling that commitment that we've made to Fayette County. Hospitals are usually the largest employers. They are the economic engine. They are the reason, along with education, that business leaders decide to come to your town. And so it's very, very exciting for us to be a part of that, especially with what we didn't know back then, all the development that's happening here so close by, which is great for Fayette County. And our vision is to be a part of that, support that, grow that, and continue to be that economic engine, but more importantly, the health engine of this community. So, you know, when we think about Adena, at Adena, we believe the health of a community is more than just a hospital. Josh referenced, by the way, he didn't say it, he was born here too. I wasn't born here. But it's more than just a hospital. It's about that access. It's about that access and being here in your time of need, right? That time of need. But more than that, as others have mentioned here, Brian and Josh, is about bringing care that's not here today to keep you healthy so you don't have to come to the hospital. It's about population health and managing that health to keep our communities strong. So I am really excited. Words can't describe how excited I am, because there was actually a time over the last 3 years we had COVID, and then we had more COVID, and then we had the economic downturn, and I was like, oh my gosh, are we ever going to get this hospital built? And I remember in this building over here that when we rolled out the design of this building and where we're going to go, I asked the question that day, how many people believe we're going to build a hospital? And there was a lot of people, probably some of them are standing here, and said, oh, we are waiting to see it. Well, guess what? We're getting ready to do it. And that's what we're here today to do. And so I say, let's dig that ground and let's make this thing happen. What do you say? All right, let's do it. 3, 2, 1.
Obviously a great benefit for Fayette County, but because of the central location, do you figure that maybe you'll be getting people from Western Ross, Eastern Clinton County?
Well, it's a community hospital, right? Now that's the main point. And so it's whatever becomes most convenient for the patients. You know, that's the advantage of a local hospital. I've driven to Columbus for many years for different treatments, and to not have to do that, it's incredibly different.
Tony, just your first thoughts about what this facility is going to mean for your county.
Oh, growth, opportunity, better health access. There's nothing like a hometown hospital for the folks that live here. When you walk in with your sick child, or you walked in, after an accident, you want to know the people that you're going to see. You want to know that you're going to get good care. I can't say enough about Adena, the finance group that has put this package together. These things aren't cheap, and it's going to be a great addition to the community.
Was there any point in the last 4 years that you had doubts?
Well, when COVID's raging the way it is, when you have a change in administrations in Washington, D.C., when you have change in administrations in Columbus, there's always reason to wonder. I don't know that it's worry, but you want to get in there and try to make sure that the policy is headed where it's beneficial for us. Everybody else needs to get in and do their own. But we always go to Columbus to try to bring home something that's beneficial for us. And like I say, Jeff and the folks at Adena have been wonderful to work with, very, very supportive. So I wouldn't say we were ever worried. I farm, so I understand the issue of time. and you can't make it rain and you can't make it stop. So we just try to be the best we can be till we get the chance.
And lastly, I think it was your comment about a community of 28,000, the county, having a high-tech facility like this in your hometown.
Right.
That's not something you see every day.
No, it's not. I like to hearken back on the originators of the hospital. You know, their foresight, their dedication, you know, to their neighbors, to their kids, you know, it has, with some rough spots, continued on over those years. But I've talked to very few people that were dissatisfied with the immediate care they could get at Fayette, and it's only going to get better.
Joe, talk about what this facility will mean to the city of Washington Courthouse.
It's a long-term investment in our community. You want people to be able to have the ability, if they choose, to have as many medical procedures and issues taken care of locally as opposed to the hassle of having to drive to Columbus or Dayton or Cincinnati. And really, you know, I've never been to the Fayette Memorial Hospital that I haven't had care from somebody that I knew at some point in time. And that it's an important thing that ability for us to be able to care for our own folks when they're in need, that's very important to us.
Also, in relation to what this might do economically for the city.
Well, certainly it reinforces the ability to continue to attract employers. When Honda looked at the area, the hospital plans were one of the things that we brought up immediately. That really, in terms of it being a whole community, a whole functioning community, it's very important for that.
Jeff, not only for the Washington Courthouse, Fayette County community, what does this hospital mean for the region?
Well, it means, just like I said earlier, you know, healthcare is really the stable. It's the foundation that helps a community grow and build. And when you think about the jobs, usually hospitals, especially in your smaller communities like this, where not only there for you in your time of need, but we're the economic engine. We're usually the largest employer. Along with education, it's what other businesses are looking for. And here in Fayette County, we have, golly, an explosion with the LH battery plant and other facilities that are coming to this community. This hospital is going to be there to meet their current needs, but well into the future. And it's so exciting to see what's happening here in Fayette County.